And one day within the week after her birth, she calls me. She goes, Bracha, I have a question. She's like, am I supposed to be traumatized? And I was like, that's a good question. Like, I want to know where's this coming from. I'm like, why do you ask? She's like, well, all of my friends are calling me. Like, every single one of my friends are like, oh my God, I heard you have a C-section. Are you so traumatized? Like, was it so traumatic? She's like, is something wrong with me that I'm not traumatized? And I was like, no. And it was so amazing because she's like, here I have these friends who most of them had vaginal births and they feel so traumatized by their birth. And I had a C-section that I didn't initially want, that I wasn't expecting, that was an emergency because my baby wouldn't be okay without it. And how come that was not traumatic?
Giving birth is one of the most significant events of your life. Sadly, the joy that you should feel can often be replaced with anxiety and helplessness instead. As a labor and delivery nurse, I'm revealing insider information to educate you, reassure you, and decrease your fear. In this podcast, you'll hear empowering birth stories and experts weigh in on a range of topics. Being Jewish also has me exploring Judaism's influence on the reproductive experience. However, I speak to anyone wishing to navigate their journey with more joy and confidence. I'm your host, Chani Fingerer, and you're listening to the Happy Birthway Podcast. The Jewish weekly day of rest, Shabbos, is so precious and sacred. However, many women find it challenging to refrain from applying makeup on this festive day. Enter Seventh Day Shine, a revolutionary skincare and makeup line that can be applied on Shabbos while keeping halacha. Their foundation, blush, bronzer, eyeshadow, and eyeliner and lip powders come in a huge array of colors, and their application brushes are so luxurious. My favorite product is Luminosity, an intensely hydrating and refreshingly scented serum that's especially formulated for permissible application on Shabbos. Check out their full line on seventhDayShine.com. The number 7 THDAYSHINE.com and enter Birthway10 for 10% off your purchase. Find the link in the episode show notes. It takes time and practice to master the skill of the newborn swaddle. So here's my hack. Go to elliesandco.com. Among their full line of gorgeous, high-quality baby bedding and layette sets, you will find adjustable swaddle blankets that take out all the guesswork. With a pocket for baby's legs and adjustable wings with secure closures, your baby's swaddle will be perfect every time. Go to elliesandco.com, that's ELYSANDCO.com, and enter BW10 for 10% off your purchase. Link in the episode show notes. Welcome to another episode of the Happy Birthway Podcast. This week's episode is so special. I have the honor and privilege of interviewing Bracha Bard-Wigder, also known as Balabustas. Bracha was born and raised in Brooklyn, New York. At the age of 20, she got married and learned abroad while living in Israel with her husband. She studied and became a bridal educator, sex coach, and birth doula. Bracha is passionate about women's health, most especially sexual health. She believes every woman deserves to feel confident in her body and her choices, both in birth and in her relationships. She now has over 10 years of experience dedicated to empowering and educating women. Bracha enjoys normalizing conversations that are taboo within her Jewish communities. She appreciates breaking stigmas and is a committed community activist. She's also the founder of balabustas.com/forum, an online community for Jewish women. She lives with her husband and their 2 children in New Jersey. Welcome, Bracha, to the Happy Birthway Podcast. I am just so honored and delighted to have you here.
Thank you for having me.
We have a lot of things we can talk about. You have incredible credentials, but I'm thinking that something that is really on a lot of people's minds is the doula topic. Can you describe to us what a doula is, what your training was to become a doula, and what made you interested in actually becoming a doula?
Sure. So a doula is somebody who is an emotional and physical support to moms and their families during labor and birth. Primarily the mother, because she's the one going through childbirth, but it really does affect, of course, both partners. And as a doula, my primary role was being there for women at a very vulnerable time in their life. And a lot of doulas actually become doulas because they're obsessed with childbirth. You know, those women, I'm sure, with with the position that you're in, you've met a lot of probably doulas or other childbirth educators and professionals like that. They were just very, very into the birthing and the process and how amazing the body is, which is all true. So some people have a calling to like the topic about it. That wasn't mine, actually. A lot of people think that, but it's not. For me, it was more of the advocacy role. Being able to advocate for people, for women in a vulnerable time in their life is what attracted me to the doula profession. So it wasn't so much about the birth itself, rather than being there for the woman in a time of need where she didn't have a voice or needed to question certain things or didn't feel like she was being heard or listened to. That a doula plays such a vital role in that. And I mean, I believe a good doula should be able to do that. It's just a matter of when someone becomes a doula, why do they do it? Is it because they love birth, they love childbirth, and they want to then help the woman get through it? Or is it because they love advocacy and childbirth just happens to be the setting in where they pursued their passion?
I love that facet. I really relate to that. You know, it's interesting because I would think that's the same thing that drew me to become a labor and delivery nurse, just because I had a really bad experience. My first birth was a really bad experience, and I kind of felt that calling because I wanted women to experience care that they should have, that, you know, I should have experienced in a respectful way.
For whatever reason someone goes into a profession, it's obviously their right, their choice, their desire, their passion. But a lot of times people have asked me, like, why do you feel like you as a doula are set apart in some ways from other doulas? And that's when I kind of made the connection. I realized as I was communicating with other doulas in doula chats, doula groups, or the organization, like reading the magazines from the organization that I'm certified with, which is Donna. Donna, just to tell you the credential aspect, Donna is an international organization for doulas. It's actually the only one that's international, which means I'm certified to do a birth anywhere in the world.
Yeah, that's the gold standard. And I want to make it clear that the doula industry is not regulated. The profession, rather, is not regulated, which means that there's no like national organization that sets forth the criteria that somebody needs to meet in order to become a doula. So I think that's important for people to know, because they should ask their doula what their credentials are, where did they get their training, and research whether that aligns with their values and their desires and what they want to get out of hiring a doula.
Correct. Like, for example, there are some doula organizations that, the training is 1 weekend or 3 weekends long versus my training was for almost a full year.
Yeah. And power to you that you did the responsible thing of really getting a good, thorough training before you started practicing, because someone technically can get away with a 1 week training.
And some people do. It's interesting. There are people, of course, there are doulas who did the long training and they're not great doulas. I mean, at the end of the day, the training part is extremely important and valuable, in my opinion, because it's the basis of what you're going to what you can build your practice on, the technique, knowing what kind of questions to ask, what the standard of practice is, even what the scope of practice is. Not every doula knows, right? Some doulas will overstep their boundaries and, argue with, medical professionals or the doctors in the room, which is extremely unprofessional and out of the scope of practice, right? So the training part is extremely important, but the rest is really also the experience, like the passion, what drives a woman to do it. Some people are like, oh, well, it's just a good way to make cash. I'm like, well, that's not a very great reason to go help somebody in the most private point in their life, So for me, it was about helping women in a vulnerable situation and helping them be empowered and have a healthy birth process, as opposed to being like, oh my gosh, I need to see that placenta,
Right.
Which for some people, that is the way it is. And that's okay if that helps them be a good doula. What I'm trying to say is that when I realized the differentiation when I was repeatedly being asked by doulas who were senior to me, right? They were in the field for a lot longer than me, technically had more experience than me. And they're like, how come you're getting 3 times as many calls as I am? We would talk about it. And I'd realize when you go to a birth, you're caring so much about what her body's actually experiencing and what she's doing and what the baby's going to look like and, what the placenta looks like, as opposed to like, hey, mom, how you feeling?
Yeah.
Which was the angle that I was coming from.
It's such an interesting differentiation. I didn't really honestly think about it so much. And that's extremely insightful. As a nurse, I mean, I went into this work very similarly for the reasons that you did. I do love the medical aspect of it too, which is, let me check out that placenta, But as a labor and delivery nurse, a lot of our job is also advocacy. I've learned so much being a nurse in terms of coming across so many women in very difficult and hard circumstances having their baby. I have patients where their lives are hard. Either they're having trouble with their partner is not supportive in one way or another, or they have some health complications, or the baby may have some health complications, or they just have difficult life circumstances like their parent passed away not long ago. Whatever it may be, or this is a pregnancy that was not expected, the infidelity that they found out about during pregnancy. And I do feel very much like you, like I've really been exposed to reality where women do need a lot of support, like a real
emotional support.
Yeah, emotional support. And I think doulas are amazing. Like you said, unfortunately, the doulas that kind of go beyond their scope of practice and try to play healthcare provider, they kind of ruin it for the other doulas and give them that cliche reputation of, oh yeah, the interfering, annoying doula.
Right. Unfortunately, they really do ruin it for the profession.
Yeah, because I would say for myself, I've come across much more good doulas than not good doulas. And I personally love to work with doulas. I kind of love to kind of explain things to them also as a nurse, even the quote unquote difficult doulas. I think once they understand a little bit more, they back off, or, I will redirect. And every time a doula may answer for a patient, which I want to ask you about, a doula may answer for a patient, then I'll redirect and look at the patient and say, what are you feeling? Can you talk to us about that, like a doula speaking for someone, or whether the patient is supposed to speak for themselves?
Such a good question in terms of the advocacy role as a doula, because on one hand, I have clients who hire me who were like, Bracha, I'm hiring you because I want you to be able to advocate for me on my behalf when I can't, which is a very realistic scenario in labor. I mean, women are having contractions sometimes back to back every 2 to 3 minutes, sometimes for hours long. If they don't have an epidural or other pain management, medical pain management, then they are under this, they're under duress, basically. They're just full throttle in their labor and not really able to communicate or speak up for themselves at that time. And that's sometimes when, nurses or doctors will come in and try to convince them or push a certain medication or a process on them that they originally didn't want.
Right, like some intervention.
Yeah, some kind of intervention, thank you, which may or may not be what would be good for the mom at that time. I mean, we of course see both happen. And so the doula has a unique role where she can educate the mom and provide the information to the mom so that she makes an informed decision. In my opinion, that's the most important thing. The question is, how does that present itself when you are in labor? And the way, I don't know how, I can't speak of all doulas, how they do it. I mean, I know there's different methods, but the way I have done that is prior to labor, when I meet with my moms and I sit down and I talk to them about what their hopes are for the birth. I mean, I know other people call it like a plan. I always say like, well, we can't call it a birth plan because we can't plan your birth. If there's one thing predictable about birth is that it's not predictable. So we can't say what's going to happen, but I would like to know your wishes, meaning ideally in an ideal situation, if things are going well, what would you like to experience? What would you like to happen? So I call it birth options because it's like there's options. There's different things that could happen in different scenarios. How would you like it to go? And so I discussed this with mom before, you know.
Thank you for touching upon that. That's really important to actually be educated and to know the options beforehand. It's funny because I used to shy away from the word plan too for precisely the reasons that you do. But I came to this conclusion that we talk about a medical plan of care. So I feel like it's really not as bad to use birth plan because the plan of care will continuously change, as will the plan of birth.
True. The medical plan though is more like what may need to happen from the medical standpoint because it's necessary, as opposed to preferences, right? Birth preferences is what do I prefer? Like I'd prefer to not have Pitocin possibly, which augments labor, but what's if mom is stuck on 7 centimeters for 5 hours, right? So there is, that would become a medical thing that interferes with her actual wish. So what I do is, because I get to know mom before and we sit down and we talk about what your preferences and what your options are, then I'm able to know in labor what mom may have wanted when doctor or nurse comes in to introduce a certain idea or intervention. And the way I advocate for mom is, if a mom is in the middle of a contraction, that is the one time I will always be vocal and speak up. I'll say, she's in the middle of a contraction. Can we give her a minute to compose herself? And then she could answer you. And then what happens is doctor or nurse or whoever is introducing the intervention or idea to them is now discussing it. And in my meeting with the mom before, I sit down and I tell her, look, there might be a point in your labor where they come in and they tell you, do you want Pitocin? Can we give you Pitocin? Do you want an epidural? Even though you told them twice that you don't want an epidural, whatever it is. And they think that what they're trying to suggest is what's best for you. And that might be true, but it may still or not be, or may not be what you want regardless. And so I tell them that in that instance, instead of turning to me in the moment in real life and saying, Bracha, what do you think I should do? I teach them, well, don't do that. I tell them, listen to everything that they have to say, absorb that information, and then you can always ask for privacy. A patient has the right to ask the doctors and nurses, could you please give me and my spouse, me and my partner, a few minutes to discuss what we would like to do. And I feel like that's a very, very respectful way. I mean, I'm sharing like a huge doula trick right here. So doulas, listen up. I've done this for over 12 years and it has not once failed me. And here's why. The patient is showing the practitioners that I'm respecting you. I heard what you have to say, and you're not being confrontational. Then they get to have a few moments to themselves where they actually get to process and rehash what was this information that was introduced to them. They get to think about it. If they also have questions for their doula in that scenario, someone's in the middle of active labor, they're not remembering now, what's Pitocin? Why do I need it again? Bracha, could you remind me? It's a non-confrontational way of us having a conversation where I get to explain to my client, I get to explain to mom, what are the pros, what are the cons, what are the risks, what are the benefits? At the end of the day, it's the patient's decision, and the patient does have the right to say yes and no. And that's also part of the empowerment, that I get to remind them, hey, it's your birth. You have the right. You have the right to say yes to this treatment. You have the right to say no.
Yeah.
And then the doctors or nurse come back in and say, hey, what do you think? And then mom gets to communicate back what she actually wants. So the advocacy happens, but it was more quiet. It's not confrontational. It was happening in a way where mom and dad got all the information that they needed to make an informed decision. They can even ask me my opinion. You know, they could say, hey, Bracha, what would you do if this was you? I'd be like, I'm not telling you what to do. It's your choice. But I'm reminding you, I'll give you an example, right? Let's say they're like, sometimes it happens in some hospitals that for the third or fourth time in a row, they're coming into them. They're like, are you sure you don't want an epidural? You look like you could use an epidural. Why don't you just get the epidural? And it's just like, you know, ad nauseum, so to speak. And like, at some point it starts to look very appealing. When mom's in a lot of pain, she might think, well, yeah, I'd like to have that, right? But at the same time, they're like, well, I really didn't want it initially. So that's when a mom asks me, hey, Bracha, what do you think I should do? I'm in so much pain. I don't know. I'm so tired. I tell them, look, you're doing amazing. You initially didn't want it. That being said, if you want to get it now, I support your decision 100%. I support whichever decision that you make, but I'm going to remind you, you're doing so well. Look at your progress, whatever it is that I know that she may need to hear to have more empowerment to be able to carry through another contraction, another hour, another level of getting through her labor. So basically, that's the way I advocate. I've never once argued with doctors head on. I don't think it's professional. I think it's completely uncalled for. I know other doulas who have unfortunately gotten thrown out or blacklisted off of certain hospitals.
Wow.
Yeah, and that's never ever happened to me because I advocate for my clients, but in a way where you need to know your place. You have to respect the doctors. You must respect the nurses. They're also there with good intentions and with wanting what's good for the patient. Sometimes we might have a different opinion of how to get there. But overall, we all have the same goal, which was we want mom and baby to be healthy and safe. And just the doula is there to help make it be more emotionally safe and sound for mom and dad as well.
Wow.
Yeah.
Wow. I love the advice of, asking for some time. I do that all the time in my practice, once we go through whatever it is and say to the patients, we're going to leave the room and you guys are going to have the conversation. If you have anyone to call to help you come to a decision, then by all means. And of course, also, I do find as well that just giving them that low pressure of the decision is up to you. Here's the information that we present, and just leaving and letting them kind of figure it out for themselves. So that is excellent. I don't know what's done in other hospitals if a patient is routinely provided with that option, but yes. And
I want to interrupt you there and say, no, actually, it's really not. I was about to compliment you for being a nurse and offering that option to your patients is so valuable. Like you're one of those nurses that, when women come out of labor and birth, they'd be like, oh my God, I remember I had a nurse and she was so amazing. She respected my privacy. She listened to me. She walked out when I needed space. She came back and asked me questions or offered support when I needed it. That's really what women need. Like nobody wants to be told over and over again what they should be doing when they already expressed, I don't want to do that. Like people should have and do need to have the right over their choices and their birth. That's part of where the autonomy piece comes in. What do you think? Do you think that if more nurses did that we'd have much better outcomes for mom?
Definitely. And I think that there is definitely a shift going on right now. There's kind of a revolution where we're really, as nurses, and even, residents, midwives, doctors, we're really shifting that culture. I think that it's also dependent on individual hospital culture, and you being a doula with so much experience, I'm sure you've experienced many different hospitals, and you could see for yourself firsthand how really there is a different hospital culture in every place. So, I think it's dependent on a lot of things, but yeah, we're really shifting and we're really becoming more conscious of the importance of shared decision making and including the patient in their care and involving the whole family. We call it family-centered care, where we're centering the care around the family. And yes, realizing that we don't know what's best for the patient. The patient knows what's best for them. They just have to have all of the information about why certain recommendations are being made.
Correct.
And also knowing how to present the recommendations to them and their information, because people will say, well, they told me that if I don't have Pitocin, then me or my baby might die.
Right. Yeah. Or if I get an epidural, I'm going to become paralyzed, right? I'm like, no, probably not.
Yeah.
Millions of women get it every day. I don't know, millions every day, but millions every year for sure.
As I heard many anesthesiologists say, your chances of becoming paralyzed from an epidural are lower than your chances of getting hit by lightning.
And this is not, God forbid, to make, not making light of moms, some women's concerns that they have surrounding getting an epidural. There are people who experience side effects and so on, but sometimes the information is so exaggerated that that it's just misinformed. And that's where information is everything. Education and information is key. When mom really knows what are the pros and cons to each procedure, what are the pros and cons to different interventions, why it makes sense in some scenarios to say yes to Pitocin and other scenarios to say no, thank you. Which I have, seen, of course, play out over and over again. I'm sure as a nurse you have as well. It changes the whole experience. And obviously as a doula, I'm very happy that the culture is changing, because when I was on the floor 10 years ago, that wasn't at all the culture. It was very much, it's our way or the highway kind of thing overall in childbirth in America, and it's absolutely shifting in a good way, which is obviously fantastic. I feel like the younger nurses are just more intuitive in a way. I think they're just like watching more information about women speaking out against it, like the advocacy that is going on around childbirth is definitely getting louder with like social media and other doula organizations speaking out and getting, a little bit louder about it and more clear about what the woman's rights are in labor and delivery. Obviously, some lawsuits were piled onto that scenario as well, where women didn't have the right and were told too bad and were forced into certain procedures that they did not consent to. So I think a combination of things made it that the newer nurses are definitely more aware, as well as some doctors. And some doctors are just more old school and they're very set in their ways and they're not changing for nobody anytime. And then there's other doctors who've been in the field for a long time. And it's just amazing to see that they pivot and they keep moving with the new information, right? 10 years ago, certain doctors automatically did episiotomies for first births no matter what. And I know that some of those same OBs now do not have that policy anymore. Some held on to it and some let it go because they saw that the science, the evidence surrounding it was not sound, and it shouldn't have been routinely done to begin with. And they went with the new science and the new studies, new research, which is, of course, again, incredible. It just helps the outcome for the mom and family be that much healthier.
I wonder if that's also a result of the education that we are getting in nursing school, because when I was in nursing school 7 years ago, it was taught to us over and over again the importance of family-centered care, the importance of patient involvement in their care plan, the importance of, like you said, patient autonomy and informed decision-making, shared decision-making, actually, I think is a better way to say it, where, the provider obviously is making the guidelines and recommendations. And I can't speak to medical school, but I have a feeling that that's probably something that's emphasized more in medical school as well. I know that midwives are extremely focused on that too. So I wonder if that's part of it. And information is much more readily available today, and for good and for bad. But I think also years ago, like I speak with my mother-in-law who gave birth in the 60s, 70s, and 80s, and she said that they just did whatever the doctor told them to do. There was no involvement. It was just...
There was no such thing as even asking a question. It was just...
Right, yeah.
Whatever you say. Yeah,
exactly. And nurses that are practicing for 30 years that started practicing in that time, I do see that they do practice a lot more in that way, where we're taught as nurses more recently that we need to question and we need to advocate and we need to know why things are being recommended and the research behind it. We're encouraged to continue to do research and to improve our practice. So again, it's a shift overall in all the education that healthcare providers are getting.
I could just give you an example where I even see it within the nursing staff is like, for example, 12 years ago when I was just starting out as a doula, if I brought a birthing ball, like 99% of the time nurses looked at me like I fell off the moon. They're like, what is this? Why is this here? Some of them made me deflated and be like, there's no room for that in this room, when there was, but whatever. And now it's shifted so much that sometimes I'm in a hospital and they're like, do you need a peanut ball? Like they're offering it. And I'm like, yes, please. I mean, I have one in my bag, but if I don't have to blow it up and make noise, with my pump in the room and there's one ready available, like why not? And that just shows you like that's a massive shift in 10 years where you go from I don't know what you're doing to, oh, can I give you this? So yeah, it's definitely shifted tremendously.
Yeah, you remind me 7 years ago when I started out, peanut bowls were just starting to gain traction, and I advocated for a peanut bowl in one of the hospitals I worked at. And when I left that hospital, I would still get coworkers messaging me, we used the peanut ball, and they called me the peanut ball queen. And every time they'd use the peanut ball, they thought of me because, when I get enthusiastic about something, everyone has to know about it. And they'd be like, we used the peanut ball for someone who was having a hard time dilating and they went so quickly and they had the baby. So yeah, and definitely like we have all of that stuff in our hospitals too. Although even if someone's hospital has peanut bowls or or labor bowls or whatnot, they should be aware. I'm sure you'll attest to this, that there are limited amounts and
Correct.
there's not one available for every room. And
right, which is why as a doula, I always brought one in my bag regardless. I never ever removed the round bowl. I never removed the peanut bowl, anything else, even like a cool washcloth. Some hospitals have washcloths, and guess what? Some don't. Some hospitals don't have a washcloth, so I pull one out of my bag. I bring, my bag is fully stocked with whatever I think would be helpful. And yes, while it's nice that some hospitals have this and provide it, I don't think that, women should just rely on it if they know that they really may want this tool.
yeah.
But it's really, really fantastic that it's so different now than when I started. I think in that way, like maybe the doulas today, in the same way the nurses today, have an opportunity to bridge that gap and communicate more effectively, help mom have the best care possible in the way where like we're not really seen as
An interference.
yeah, like for, again, back then when I started, it was like we were kind of tiptoeing around each other a lot of the time. It was like, oh, the annoying doula is here. She thinks she knows everything. She's going to tell me what to do. Because unfortunately, there were doulas who were doing that, even though I wasn't. And then there were also the doulas who were like, well, the nurses are like so obnoxious. They're telling my client, they're telling the patient, the mom, that she has to stay in bed no matter what, which is true. She doesn't, unless that's in that particular scenario, mom's or baby's in danger. But most of the time, that's not the case, right? So, while both work towards communicating better and being softer in how they push for certain intervention or accept intervention, I think that overall that is reflecting in much better care options for mom and family.
I love that. I love that. And each team member is so important in the support team that a mother has in labor. I love that so much. And I do think, forget about doulas that may have been like interfering and a little bit too much. I think that even a good doula, I'm sure that 10 years ago, they were kind of disrupting the atmosphere. They were kind of disrupting the whole birth market where, like you said, I still hear about it today where if someone's water's broken in certain hospitals, they're told that they have to stay in bed, they can't get out of bed, and they have to use a bedpan, which is absolutely ludicrous to me. I've never experienced that in my personal practice, but I think that doulas came in and kind of disrupted the scene and said, hey, like questioning things, and that's not convenient for staff when they're used to doing it a certain way.
Right. Or they're like, what do you mean? I need to help you get out of the bed instead of just bring you this plastic tray that you could urinate on right now, right here, which I've been doing for 30 years for my patients.
Right.
For someone who's set in their ways, it's a culture shock.
Right. And even from a liability standpoint, some nurses were falsely taught that when someone's water is broken, then the umbilical cord can become compressed more easily and cause an emergency, so they can't get out of bed, which is, again, untrue. I think that maybe doulas have also earned this maybe not the most flattering reputation, which I do think is improving, but in the sense that they are disrupting the birth culture and advocating like you are for a patient and saying, hey, listen, like, is this really necessary?
Right. Well, I mean, like I told you before, I definitely did it in my quiet way because I believe that that was a more professional and non-confrontational way. And by the way, it's not because I'm not someone who shies away from confrontation. There are some people who are terrified of it. I'm personally not. I just felt like it's not professional. Like, it's not professional to be in a birth setting where there is a chain of commands, there is a hierarchy, there are doctors and nurses that earn their degrees and deserve and command that kind of respect. And who is a doula to just come in and overstep that, right? But at the same time, it's like, well, yeah, I am hired privately, independently by mom. I'm here to advocate on her behalf. And perhaps the intervention that you're suggesting is actually not scientifically sound and it's just more convenient for you. So in that situation, yeah, I'm going to advocate for my client by encouraging her with giving her the right information to advocate for herself. And so that was my method. That being said, even though I did this quietly, it doesn't mean I was never met with other confrontation or nurses or doctors still being demeaning to me, or, short with me or giving me looks, like, meaning knowing when they came back, when they left the room, the patient was listening. When they came back, the patient had new questions, right? Or a client refused that certain care because they didn't want it, so they politely declined. They would give me a look like, oh, I knew they were thinking like, oh, it's all her fault. And I'm like, well, too bad. You're never going to know. But like, do you know what I mean? It's like, That's my job. And by doing that job in a respectful manner, I believe that it's doulas like me who helped us get to where we're at today in the sense of, helping women, like you said, changing, interrupting the birth process as they knew it and helping it be more patient centered. And that which was crucial in removing so many of the routine interventions that they were doing that were actually medically inaccurate.
There's so many standard policies, protocols, procedures, and nobody's standard. So we need to remember that. And sometimes we do get kind of swept away in our tasks and forget it. And we need to stop for a second and, kind of collect ourselves and remember this is a patient that's individual. For them, this is not a routine process. We see birth every day as nurses and doctors, but this is something that's going to be an extremely rare event in their life that they're going to remember forever. So the respect, I think, it trumps everything. I think just completely can make or break their birth experience. That I see this all the time where people can have a really medically complicated or difficult birth, but if they're respected and they're made to feel safe by their entire birth team, healthcare providers and doula, then they're going to come out feeling empowered despite it. Doulas really, I think, give the mother the stage for her voice. Like, you validate her right to have that voice and to ask her questions and to vocalize where she may be intimidated to do so if not for you.
I would say that's one of the most common scenarios why women end up consenting, which I say very carefully because it's not kind of consenting because they didn't really consent. It's naturally informed consent because
it's coercion sometimes.
Correct, because they don't feel like they have another option. So if they don't feel like they have another choice and they said yes, is that really yes? No. So there's definitely a lot of women, unfortunately, who, like you said, like these women, for them, even though for the nurses and doctors, it could be, oh, we see this every day, but for them, that's the birth that they remember. It's not only the memory, it's everything surrounding it, how it actually impacted their life. There are women who have so much birth trauma or, negative associations towards their birth because of the fact that they felt not in control or like things weren't explained to them or their voice was not heard. I'll actually give you an example of this, of how different it could be for somebody who had felt supported and advocated for as opposed to someone who did not. I had a client about 2 years ago who is literally one of the handful of C-section clients that I've ever had in my career because, if it was possible to avoid one, that is part of my role. Meaning when it's not medically necessary.
And the research is there and very clear.
Oh, 100%. The studies show that women who have doulas are 38% that they know of, and it could even be higher. That's the latest statistic, 38 to 42% less likely to have medical interventions, and it included C-sections in that study.
Yep.
That's an enormous statistic. So there's absolutely studies and research and data to prove, not only suggest that doulas actually help prevent even major abdominal surgery, right? So I have a client who unfortunately needed it, and I actually saw it coming in this particular situation. Her baby's heart rate was dipping pretty much from the start of labor, which is not really a great sign. When someone's 2 centimeters dilated and their baby's heart rate is dropping, here and there, you kind of start thinking, well, is this baby going to make it to 10 centimeters if it's hours and hours long, and be able to go through a vaginal birth process? And I didn't say anything initially because it could just be that that's what the monitor was picking up. But the longer they kept her on, and we were following, obviously, safety protocols for that, and kept her continuously monitored as opposed to intermittently monitoring her, the baby was just showing more signs of potential distress coming, his or her way. And that's when I actually sat down and explained to her. I showed her how the monitor works. I showed her, in like very basic terms, in between her contractions, how we know how the baby's doing, what the heart rate zips mean, why it could be happening, or also that we don't know why it would be happening. And that just to kind of emotionally, mentally start preparing her for the fact that if her birth ends up being that if it gets if the baby's heart rate continues to dip like this, it's possible that she'll need a C-section. I basically started laying the groundwork for her, and she, in a non-panicked way, and she was totally understanding and accepting of that. And I asked questions and I answered her and so on. Anyways, to wrap up a long story in short, which is 10 hours in the making, the baby's heart rate did continue to drop, and at some point they did call it. I mean, the midwives, she actually had midwives who have a tiny statistic of C-section in their practice as well. I think they were under 2%, which is amazing.
Wow.
This was upstate New York. And, they told her also, you may need to have one. And within like the hour, baby's heart rate just kind of tanked within 5 minutes, and they were like C-section stat. So of course we rush in, we get scrubbed up. I was with her the entire time. I had music playing by her ear from my iPhone. I was holding her hand, holding her shoulders, and just whispering in her ear and helping her stay focused and calm. And she had her C-section and she had her baby, and thank God her baby's okay. Couple days later, of course, I'm checking in with her, every other day. How you doing? How you feeling? And one day within the week after her birth, she calls me. She goes, Bracha, I have a question. She's like, am I supposed to be traumatized? And I was like, that's a good question. Like, I want to know where's this coming from. I'm like, why do you ask? She's like, well, all of my friends are calling me. Like, every single one of my friends are like, oh my God, I heard you have a C-section. Are you so traumatized? Like, was it so traumatic? She's like, is something wrong with me that I'm not traumatized? And I was like, no. And it was so amazing because she's like, here I have these friends who most of them had vaginal births and they feel so traumatized by their birth. And I had a C-section that I didn't initially want, that I wasn't expecting, that was an emergency because my baby wouldn't be okay without it. And how come that was not traumatic? And the answer to that was that she had support. In my opinion, she had information, she had support. I was explaining to her everything, every step of the way. I was there for her. I was with her. She wasn't alone. She felt and she knew that this C-section was necessary to save her baby's life. And therefore it wasn't traumatic in that way because she went with it and pivoted with me in explaining to her why it was needed. And so when it happened, it wasn't a complete shock. And even so, afterwards, she was able to come out of it with that knowledge of like, okay, it's what I needed. I accept it and I'm okay. I had people there who were speaking like with me and for me on my behalf and explaining things to me. And the bottom line is that I was not alone. And I think that so many women who have birth trauma, it's because they feel alone. They don't feel heard. They felt unseen and they felt completely alone. And as a birth professional, I think that is the highest reason why people have birth trauma, where they didn't have control. They didn't have a right. They didn't know that they could refuse certain things. They didn't know how to say no or that they can say no. They unwillingly consented, so it's not really informed consent, and that causes trauma.
Yes, you couldn't have said it better. Yes, I think the power, right, which is the same thing I would say as control, where, I mean, we know we have no control in birth, but just that power, feeling the power that you have in your situation and having that taken away from you. So yes, do you know Penny Simkin? I'm sure they mention it in the...
Yes, of course. I took in Israel, which is where I did my training, my doula training. Penny Simkin came to talk for all birth professionals.
Wow. I'm jealous of you.
I know. I was like, wow, I'm just starting this like birth certification and I'm meeting like the mother of all doulas type of thing. I mean, not doula, birth advocate all around. So you're talking about a couple hundred women all there listening to Penny. And in the end, they did a raffle and I won her CD. I had to be like an amazing physical support in time of labor. So that was pretty cool. But yeah, it was definitely an honor to meet her.
Yeah. So for anyone not familiar, Penny Simkin, just really short, is actually a physical therapist who dedicated her entire career to birth and the physiological process of birth. And she is just incredible. She actually really lays a foundation for my practice. And she says, you can have pain without suffering and suffering without pain. And she talks about how you can have an epidural, a mother can have an epidural, but if she feels anxious, if she feels like the power has been taken away from her, if she feels disrespected, she's still going to suffer, which I think is a huge reason why doulas play an important role whether someone has an epidural or not. And you mentioned earlier a really important point that I wanted to highlight, where you said, if somebody comes in and offers a woman an epidural enough times when she did not intend to get one, and that was, her original desire, like you said, eventually it's hard not to cave, because birth is hard, labor is hard. In a hospital, labor is even harder because you're just not in your own environment, and you may have a harder time relaxing and feeling safe.
Well, it's very pretty to have a way out of the pain, especially when it's constantly, presented to your face, where they're literally asking and almost begging and pleading you, just get it. Why don't you just get it? Where they're kind of giving you attitude for saying no. And they'll be like, but why not? There's so much, even just to avoid the confrontation of that. When women are tired and exhausted in the pain, that epidural starts to look really, really pretty.
Yeah, and there are many benefits to it, and I think that it's important for every woman to have the autonomy, like we spoke about. But I do feel like in my own practice, what I've done is when I do the initial intake for a patient, right, we ask all the million questions that you're going to get asked 10 times, because every medical student and resident, anyone that comes in is going to ask you all over again. But I ask, instead of, we have like a section where we can fill out the birth plan, like epidural, spinal, what does the person want, etc. So one of the routine questions that a nurse will say is, do you want an epidural? And I started framing it as, what are your plans for coping with labor? Instead of saying, do you want an epidural? Because I do find that people who don't desire one, kind of that's already the start of them feeling kind of coerced into it. Each hospital has a different epidural rate, but the epidural rates are really high. So nurses are used to seeing most patients have an epidural. And I think that as well, when I speak to a patient in the beginning of labor, like when she can talk, if I have that privilege, but if they're having an induction or they come in early labor, I always ask them, how would you like me to ask about, labor pain and coping?
Managing your pain. Yeah.
If you don't want an epidural, would you like me not to ever mention that word unless you initiate it? And I say to them also, when someone's in transition, that means they're like literally at the end of their labor and starting to push. Everybody wants an epidural.
Yes.
Let's get real here. You can be in the forest having an unattended birth and unassisted birth, and you want an epidural. But I ask them beforehand, when they're in a calmer place where they can think more clearly, would you like me to just encourage you and say, listen, you're almost there. So you did it until now, and just encourage you to get over that hump, like you had said before when you talk to your patient, and encourage them and tell them, hey, you're doing so great, you're really coping well. Or would you like, at a certain point, would you like me to say, hey, no, you do want an epidural, so we're going to get it to you, and we're not going to withhold it from you, because that's unethical as well, right?
Oh, 100%.
So it's kind of that very fine line that we walk, where we never want to deny a patient her requests, but at the same time, sometimes they just actually need the encouragement to let them know that they can keep going, and that they're almost there. Sometimes when a patient really starts feeling a lot of pain and they start having a hard time, that's a time where I feel like a vaginal exam can be helpful. And we say, hey, listen, you're 8 centimeters, you don't have a long time to go. That's when they'll recenter themselves and say, okay, I'm almost there. I can continue this. It's not going to be another 10 hours. I think that those are really important things to bring up. Going back to the C-section story that you said, when there are providers that I know that have a low C-section rate and a patient of theirs does need a C-section, I like to really tell them, I say to them, listen, you tried everything you could, and you know that this baby needs to come out through C-section. And at that time, we can really say, like, we're blessed to be able to have this option. And I think that really also helps somebody feel kind of less traumatized, where they know they're not going to be left with these questions, where a lot of women are left with questions of, was that really necessary?
Which is tormenting, by the way. It's such a horrible feeling for women who went through a certain kind of childbirth to sit there and wonder, did I need major abdominal surgery or not?
Exactly.
That's not okay.
And finding out sometimes that no, they indeed did not, which is, I think, even harder. I wanted to ask you, I have a very interesting question, because I just want to know how you go about this. Let's just make it clear that a doula's role is not to provide any sort of medical care. A doula is solely there for psychological, emotional support, mental support, and to help a mother feel empowered. But at the same time, part of your role is to educate, which means that you do have to have some framework of knowledge surrounding birth in order to educate. So again, there is kind of a little bit of a fine line as well, right? And I had a patient whose water broke at home, and she was groupie strep positive, which is, a bacteria that's in the perianal area, and it doesn't affect us. It's not harmful for us, but some people, I think about 30% of people have it, and it can be dangerous if the bacteria is passed on to baby when the baby comes out of the vaginal canal.
Right.
So women who have that need to be treated with antibiotics, with IV antibiotics, and if someone's water breaks, usually in a lot of scenarios, it's okay to stay home when your water breaks and it's not that medically needs any medical intervention in the beginning. So if someone does have groupie strep, when her water breaks, she does need IV antibiotics.
Correct.
She needs that treatment right away because now the baby is actually exposed to the outside environment. Whereas when the bag of water is intact, the baby is in a sterile environment, not exposed to that bacteria. So in a case that someone has groupie strep, they do need to come in if their water breaks even before labor starts in order to get the IV antibiotics. Anyway, this patient, her water, she was groupie strep positive. Her water broke 7 p.m. and she didn't come in until 7 or 8 a.m.
Oh.
She came in with a doula. And so she stayed home for many hours. And, I treated her, did whatever it was, but she put herself in a potentially dangerous situation because groupie strep infection is not a joke. It is extremely, extremely dangerous. And later on, I asked her, I said, in a very non-confrontational way, but I needed to understand what happened. I said to her, when you spoke, did you let your midwife know when your water broke? And she said, yes. I said, what did the midwife tell you? Did she tell you that you should come into the hospital? She said, yes. I said, so why didn't you? She said, well, I spoke with my doula. My doula said it's okay for me to stay home and I shouldn't come in.
Ouch.
And that made me really upset because that shouldn't have happened. And so then, I respectfully approached her doula and I said to her doula, I said, that was not within your that was not within your boundaries to tell a patient not to come in against a provider's advice. And I explained to her why. And she said, oh, well, I never learned that in doula school, my doula training. And I said to her, but that's not your scope of practice. You're not giving out medical advice. So my question to you is what's that fine line of walking? And I also think that this story I'm asking you about, you had mentioned earlier briefly, where you don't want to overstep the trust that a patient has with their provider, even if you think that it's a crappy provider.
Right.
But you don't want to overstep those boundaries, which as a nurse as well, even if a provider, I think, is not providing the gold standard of care, I'm not going, unless it's something that can cause harm to the patient immediately, I'm not going to ruin that trust because this
being
is
pressured into having a C-section because the doctor wants to go to a ball game, which actually did happen. Meaning, I've as a doula, I've even experienced this. So that does happen, unfortunately.
Right. And at that point, it's teaching the patient to ask the right questions and reminding them that they do have a voice, that they do have a choice, that they do have rights. That's really where our job comes in.
That's the behind the door advocacy that I was referring to before. In that scenario, I kept reminding my client, ask for privacy. And she would ask for privacy. And I'd be like, he wants to leave. You do not need a C-section right now based on how you're doing, how baby's doing. You need to ask these questions to find out why is he suggesting it. And he literally ended up blurting out, well, the game's on in an hour and I'd like to get out of here. We were like, well, you can go.
Oh my gosh.
That's not a reason for her to have a C-section because you don't want to be here. We're okay with using the on-call doctor. She had a vaginal birth, basically, which she told everyone in her family because of me. There are scenarios like that. That's, by the way, just to clarify for all the listeners, that's obviously not the situation most of the time. Most of the time it's, that there is a reason, a valid reason. And, your question is basically, how do you walk that fine line between advocating properly, not overstepping the medical advice versus what the client or what the patient wants.
Yeah, and you do have that education. You have to have that knowledge base to educate a patient on childbirth. So
For sure.
you do have some sort of knowledge to educate, right? I think it's just all related. Like in a situation like this, I mean, I do think that you just based on following you, you have an incredible knowledge base that I think is exceptional for a doula. But, like, I just like to hear your take on this.
Sure. Like, I mean, let's even go back to this specific story and examine, like, where things went wrong. Number one, there's no such thing as being a doula and not knowing what strep B is. And when I say no such thing, I mean there should be no such thing. I don't mean that there actually is no such thing. Clearly, that was a reality in this story, which is very unfortunate. I think if you're going to practice as a doula, you need to be informed of the most basic medical issues that could crop up and arise in childbirth. I think it's very irresponsible to not be informed in that way. So that goes back to the beginning of our conversation today, which was, well, what was your education? If you took a weekend course to become a doula, you're not really prepared. Like, you should know what strep B is. I mean, with all due respect, but come on, right? Like, that's not okay. And then let's say someone does know or didn't know. In her scenario, the next misstep was that, why are you telling the patient not to go if her midwife said to come in? If I have a client calling me at 1 o'clock in the morning, Bracha, my water broke. And I'm like, okay, great. Is it clear? First question, right? Yeah, no, it's clear. Okay, great. Did you call your doctor midwife yet? No, not yet. Okay, call them and then call me back. That's literally what I do. I tell them, call them, ask your doctor, tell them what's going on, tell your caregiver what's up, and let them tell you if they should come in, if you should come in or not. Sometimes I'll have a client calling back and say, okay, my doctor said I should come in now. And I'll be like, did they tell you why? Like, if your water is clear, did you ask them if it's okay for you to stay home? Because guess what? Before you leave, you could call them back and ask. Sometimes doctors say, well, I'm here anyways. You might as well come in. That's not a medical reason to go in. Like, why should the mom not stay home in that scenario and sleep for a couple hours before her contractions build up and then she goes in? That would be okay to call back, though, and ask and confirm that with the caregiver. I never, ever tell patients to go against their caregiver, their provider. I mean, literally, I can't say never, ever. The handful of times that happened was in scenarios like this C-section story that I mentioned a couple minutes ago, where like the doctor's like, well, I want to go to the game. We're like, have fun, go catch a ball on your way out. What should I tell you? Like, that's not a reason to like perform major abdominal surgery on somebody. And most doctors, thank God, overwhelming majority would agree with that. So, I mean, in her charts later on, it would be that like, why did she have a C-section? Unknown. That would be one of the scenarios where the C-section was unnecessary. And it's great that she didn't have to have that.
Yeah, and I just want to interrupt you and say again, this is something very routine for us as a nurse. I'm in C-sections constantly, and doctors are constantly performing C-sections, and they all go really well. So I think, again, they kind of get into this like desensitized place where what's the big deal? I mean, yeah, C-section is not maybe preferable, but like it's a C-section, it's fine. Meanwhile, they don't know the long-term causes and effects that it has in a patient's life, both medically and psychologically and emotionally and whatnot. So, I think that that's a good place where we can really see where, to us things may be routine, but it's not routine to a patient's individual situation in life.
Right. I mean, the fact that the C-section rate is so high is a problem to begin with in this country. There are other countries that have a much, much lower statistic than America. So that is a problem. So we do know that C-sections and other interventions happen just because they're used to it, or it's routine, or they're not used to seeing it, or don't have the skill sometimes to do it in another way. And in unfortunate and really, really unfortunate circumstances where, some practitioners don't care, which then hopefully the client, the patient in the future picks a better medical provider. But my point is that fine line that is being crossed should be double checked and measured up against the caregiver as well. Meaning, client calls me and says my water broke, she's telling me to come in. I could be respectfully challenging by saying, well, call them back and ask why, just so we have clarification on that. Because if they don't have a medically valid reason for it, and they're just like, it's more convenient for me, then the patient does have the right to say, well, I would really like to stay home. Can I do that? Right? That's where the empowerment and the support comes in, where they are now armed with the right information to not have to go in for quote unquote no reason. That being said, again, if the client calls me back and they're like, well, it's a little bit, it's not fully clear, or I have diabetes and I need to go in for the medication, or I have strep B, or whatever a medical reason is that she would need to go in, I'm like, I'll see you there. You know,
Right.
it's definitely delicate, and I find like that fine line is better understood with more experience, right? So doulas who are very, very new to the field, they definitely should not be giving any kind of advice that is contrary to the medical provider. And I say that very carefully because in general, again, no doula should technically go contrary to medical advice unless the medical advice really doesn't seem medical and it's more of just a personal inconvenience scenario.
Yeah.
But which again, you just get more with experience and with time with witnessing that. So I think this doula made a couple of missteps. One is that she didn't know what it was to begin with, which is an issue. Two, I mean, have a little humility, with all due respect. Again, if you don't know what it is, don't be contrary to what the medical provider is suggesting. Go in. I mean, you really had responsibility where now your client, this patient, was home for 12 hours without antibiotics. And the reason why, by the way, some doulas would think, oh, that's not a big deal, is because there are also scenarios where we see some women come in and be like, that they stayed home and they had strep positive and everything was fine in the end without the antibiotics. So you'll have some doulas in that scenario be misled and think, well, my sister and my sister-in-law had and nothing happened to them. Well, thank God. Good for them. Thank God that their babies are okay. You can't go about it in that way just because the result of not being on antibiotics in your situation ended up working out. It's harmful and it's dangerous. And
Yeah.
I'm not, a lot of times people think, oh, you're a doula, are you like anti-epidural and anti-drugs? And I'm like, I'm not anti anything.
Right.
I'm pro whatever the mom needs, what is best, safest, healthiest for her.
Yeah.
And I think some people just forget what that actually means.
Yeah. Oh my gosh, we can go on and on. Yeah, again, you give the mother the right questions to ask, which is what you were talking about with, let's say the water breaking and getting clarification. I love that word clarification. I think it should be in everybody's little, bag of words when it comes to making decisions surrounding birth, where you can just say to your provider, can you please give me some clarification? I'm needing some clarification. And I think also safe is a very important word. So to say to your provider, would it be unsafe for me to stay home? Is there any, am I compromising my own or my baby's safety if I stay home? How urgent is it? So yeah, it sounds like you give the patient the right questions to ask and then leave it again to their provider. So I love that. I love that so much. And I'm kind of in that position too, where my scope of practice is also education, where I educate, but it's not giving medical advice. So I
Right.
can't tell a patient this is what you should be doing, but I can tell a patient research has shown that mothers whose water breaks, it's not unsafe for them to stay home for 6 to 12 hours as long as there are no other, coexisting conditions such as group B strep or meconium or whatnot. So,
Correct.
we're kind of in a similar place.
The only difference is that you're not directly in touch with the patients until they show up. And as doulas, we are. And in that sense, we have more responsibility to not be contrary to what the medical providers are suggesting.
That's definitely something that you have as a responsibility, and also you have that amazing power to educate a patient prior to them actually experiencing labor, where when they're experiencing labor, they're not in that, they don't have that clarity of mind state to actually make decisions. But if they know ahead of time what to be prepared for, then it'll, those things will come back to them. So you definitely have that power. And I have to say, what you said about, doctors that are, let's say, practicing for a long time and then they change their practices and become more up to date. A lot of times that is also dependent on the institution and the culture in the institution. Typically at more academic hospitals, they will update the guidelines. And in some hospitals, there are standard policies
Right.
for things, and providers are required to update their practices whether or not they like it, because there's a standard policy in the hospital.
Right. I mean, I also know doctors, I know some OBs, which I have tremendous respect for them, who left their hospitals that they were, at for 10 to 15 years because they were not updating. They were practicing old school policies that they thought or procedures that they thought were, medically necessary that weren't. And they went to hospitals to pursue another path, another way where they're moving with the science, they're moving with the knowledge, and moving with the times. And that is on the onus of the practitioner.
Absolutely. Absolutely. That's incredible. I have so much respect for those providers. I was recently talking to a resident that I work with, who's finishing up her residency. And she told me, she said, I want to work in a setting where I can continuously learn and update my practices. And yes, there are some places where there's really zero accountability for a provider to update their practices and education. They need to do very little in order to maintain their license to practice. So, and this is where nurses come in, where if you have a good nurse, if you have a nurse that's educated in doulas like you, we are the ones that can actually give the patient the voice and help advocate for a patient to get the best care, even if it may be in opposition to the doctor. I will say one time I got fired by a provider. Again, I'm also, just like you, super respectful and try to make the provider think that it's their idea if there's ever a question that I have about what they're recommending as a plan of care. And I just asked the provider in the nicest of ways, well, what do you think about, I know that you're thinking this medication, but what do you think about that medication? And he got so mad at me. And he said he wants a new nurse. And I said, by all means, please go to the charge nurse and get a new nurse. I don't want to work with him either. But it all worked out well. He never followed through. Bracha, there's so much more we can talk about. I'm actually just thinking, our conversations around a woman's power and the respect. I know that you also are a huge advocate for people who are victims of sexual abuse. And I would love another time to have this important conversation.
Oh my, we could do an entire podcast just on sexual abuse and birth.
The amount of people that are victims of sexual abuse, it doesn't even have to be abuse. It can be harassment and assault. Birth can be extremely, extremely triggering for them and traumatic for them. So I would love to have a separate episode having a conversation around that, because I think it can really also combine all of your amazing experience.
Sure.
Right now, although you're not practicing as an active doula, you do so many other things.
I'm on a break still since, September, but I am doing birth option sessions for women who are looking for more information in terms of providers, doulas, resources, hospital information, any information they need really surrounding birth. I do that individually. I mean, it's really just that for now, I would really love for listeners to have the takeaway that the information is there. It's out there. I mean, thank you so much for making this podcast to make it more readily available and accessible to, the Jewish birthing world and the, birthing world at large. I think it's so valuable, and I just want people to know that the information is there. There's resources, there's professionals, there's women like you and me who care about advocacy, and they can reach out. They can hire a coach, get a doula, speak to a nurse, reach out to you, whatever it is. No one should feel like they don't have options in their either birth or pregnancy, labor, and delivery process.
I want to let our audience know how they can reach you. And if you can just tell us the range of services that you are currently providing, I am going to put those details into the show notes as well, so you can find them there.
Sure. So like I just said, I do birth options or preferences for women and birth education. Primarily right now, I'm mostly busy being a sex coach. So I work with women and couples on their marriage and intimacy. And I also teach bridal education. I teach kalas who are about to get married about sexuality, sexual health, autonomy, which, again, a lot of it ties into or spills into birth. All the topics that I do very much are surrounding women's health and empowerment and support. So, right now that's what I'm doing. People can find me on Instagram at balabustas. That's my page, or they can email me, balabustas@gmail.com.
So that's BALABOOSTAS.com, correct?
Yeah, at gmail.com for email.
Right. So on your Instagram account, and then at gmail.com for your email. And you do such incredible work. I'm such a huge fan. I have so much respect for you. Your Instagram account is just so lovely and beautiful and just so sincere and authentic. I can't think of a better word to use. It's so pure. I think that's why so many people are magnetized toward learning from you, and you have such an amazing engaged following. I'm just amazed at your work, and thank you so much for giving us the time of day here.
Thank you so much for having me. It's been my honor and pleasure, and I want to wish all the pregnant listeners B'Shah Tova, and the non-pregnant ones who are just looking for information, resources, and support. I hope that this was helpful.
Thanks for tuning into the Happy Birthway podcast. Head over to Yoledet Academy on Instagram to continue the conversation. You'll find the link in the episode show notes, as well as links to any additional resources, products, and services mentioned here. If you love listening to this show, you can help it grow by sharing it with your friends and rating and reviewing it. To stay in the loop when new episodes are released, make sure to subscribe. Remember that your health needs are unique and require individualized medical advice. The podcast is not a replacement, and some of the information may not be appropriate for your specific circumstances. My mission is to educate you so that you can confidently collaborate with your healthcare team. I believe that a healthy mom and healthy baby are simply not enough. We also need a happy mom with an empowering birth experience.